My name is Miranda Volkmar, and so I'm doing an ankle assessment. And the first thing that you're going to want to do is you're going to ask your patient some questions about their history. So starting off, you would ask them, you know, what do you do daily, like if they run, or what their job is, just to see what kind of pressure they're putting on the leg. If they have recently had any changes in weight or exercise. So that's kind of the same thing as, you know, them running, but you kind of just make sure that they aren't doing dangerous activities daily, and if they are, then it helps to know what this injury could be. Next, you would ask them how exactly they injured themselves, about how long ago, where did they do it, what kind of surface were they on, if they heard any pops or cracks, how quickly did they feel the pain, if the pain was, you know, instant, or if it kind of occurred over time. Next, you would ask them where does it hurt, how often does it hurt. Maybe you can ask them to point to the pain or what kind of pain they are experiencing. Limitations, you would ask them if they could stand, if they could walk, if they could run, jump, or if any other specific movements hurt them. That way you can really tell what specifically is hurting them. So you can ask them next if they have injured that certain area before, or if they've had that same injury before. You can ask them if they have had any instability with the certain ankle or any pain. You can ask them if they had any surgeries or if they ever broke a bone down there. That's about it for the questions. Okay, so now I'm going to start the assessment, and I'm checking first from the interior view, which is the front. I'm going to observe the alignment of the toes and the position of the foot, just to make sure that they are all aligned with the leg. And yeah, we're checking for too much inversion in the ankle or any other obvious signs of injury. Next, we're going to check from the medial view. So we're going to check the arch, just to make sure that it's not obviously fallen or for too high of an arch. If there's any excessive prominences or anything like that of the medial midfoot, so just around the inside of the foot. And so now we're going to check the lateral view, inspect the ankle for any swelling. Doesn't look like any swelling, and for any more prominences of the calcaneus, and that would be just for like another obvious sign of an injury there. Now we're going to check from the posterior view, so the back. We're going to make sure that the ankles align and that they have natural valgus, which is turned out. So next we're going to check when he stands on his toes. We should see that the heels kind of go in a little bit, which is the opposite of valgus, it's varus. And so they're moving in, which is good. So now we're going to check his gait, which is just a stride. And we're going to just make sure that there isn't any obvious limping or more obvious signs of injury. Equal stride length, foot position, and weight distribution on both legs. And the feet should be within 0 to 20 degrees of external rotation when walking. Looks good. Okay, so now we're going to check the foot supine, and we're going to observe the nails for any bunions, any claw nails. See if he has any hammer toes, and make sure that he has the ability to spread his toes. Alright, next we're going to check the plantar surface. So, like this. We're going to check for any warts or calluses or any ulcerations, or, you know, just any big cuts or signs of injury. So, yeah. Okay, now we're going to start palpating to see if he has any tenderness in any of these areas. We're going to check the medial and lateral malleolus. So right around here, and in the medial side. Okay, now we're going to check the posterior heel, so turn that way. We're just going to make sure that he doesn't have any tenderness there. So right around here. And then on the other side. Great. Now we're going to check the peroneal tendons. So turn to the side. Going to check about right here. For any tenderness. Excuse me. Now we're going to check the anterior ankle. So turn, face me. Going to palpate right around here to check for any tenderness and swelling. Now we're going to check the plantar fascia, so lift your foot up. We're going to palpate the plantar fascia to make sure he doesn't have any pain. Alright. Now we're going to check the sesamoid. And so okay, so turn. Going to check right here.
Good job, Andrew.
For tenderness or pain. Okay. Now turn towards me. Oh my goodness. Going to check right here and the top of the foot for any tenderness or pain. Alright, and that is the end of my palpating. Okay, so now we're going to be testing his range of motion, and we're going to dorsiflex the foot. This is my goniometer, and we're going to check to see if he has proper dorsiflexion, so which is about 15 to 20 degrees, so go ahead and dorsiflex your foot. Looks perfect. Okay, go ahead and put it back down. Now we're going to do plantar flexion, which is about the same thing but just opposite. So go ahead and plantar flex. Great. Okay, bring it back up to normal. Alright, now we're going to check the inversion. So we put the goniometer like this, and we're going to check his inversion. Make sure that you keep the goniometer in place with the foot. So go ahead and invert and evert like this. and like this. Looks about right. For inversion, it's about 25 to 35 degrees. Eversion is 20 to 25 degrees. And we're going to just do the eversion again. So go ahead and dorsiflex your foot a little bit up this way. Alright, and we're going to evert the foot, so go ahead and go that way. Great. Okay. So now we're going to test the muscles to make sure that they are working properly. So the first test that I'm going to do is to test the posterior tibialis, which he starts his foot in plantar flexion, so like this. And I'm going to have my hand like this, and he's going to push inwards with his foot. So invert, go ahead and push this way, and I'm going to try to stop you. Okay. Looks like he can do it. Now we're going to check the anterior tibialis. So he's going to be in the same position. And now he's going to point his foot down and in at the same time. And I'm going to resist that. Looks like he can do it. Next we're going to test the peroneus longus and brevis. So he is going to plantar flex the foot, and I'm going to resist his attempt to invert and evert the foot. So I'm just going to hold it, and he's going to try to push in. Okay. And then he's going to try to push out. Good. Now we're checking the extensor hallucis longus and extensors. So the ankle is in a neutral position, and I'm going to resist his flex of the great toe, which means that I will hold right here. Looks about right. So next we're checking the flexor hallucis longus and flexors. So the ankle is in neutral, and I'm going to resist the patient's attempt to extend the great toe. So he's going to push down like this, and I'm going to resist it. Okay, looks about right. So now we're going to check the flexor hallucis longus and flexors. And the ankle is in neutral. I think I already did that. Whatever. Next we're going to check the gastrocnemius. So the ankle is in dorsiflexion, and I'm going to resist him pushing down. Looks like he can do it, and that's all of the muscle tests. Okay, so we're going to start the special tests. So first we're going to start with the anterior drawer test to assess the anterior talofibular ligament. So he's going to plantar flex his foot about 20 degrees. And then we're going to stabilize the tibia and grab the heel and pull up. We're checking for any clicking or unstable parts of the joint. Next, we're going to check the apprehension test, which is the talofibular ligament. So with ankle slightly plantar flex, go ahead and slightly plantar flex. I'm going to invert the foot. And to do that properly, you have to grab both halves of the foot, and you're going to invert it. Now, Noah here has very tight joints, so they don't move very much. Now we're going to do the varus stress test, which I'm going to assess the calcaneofibular ligament. So we're going to stabilize the tibia. Ankle is going to be in neutral.